Assalamu alaikum wa rahmatullahi wa barakatuh. Good day everybody. This is Dr. Mohamed Mursi. Today inshallah we are going to review or to have a quick review about one of the most common topics encountered in the settings of the PACES exam and in the Irish clinical exam as well, which is fatigue. Fatigue. The term of fatigue is considered as jargon, so instead of using the term fatigue when you are discussing this with the patient, you need to replace it with the word tiredness. And as usual, whenever you have got any complaint, you need to start analyzing this complaint by asking, when did it start? And how did it start? Was it sudden or gradual? And then you need to ask about, does it come and go or continuous? And then you need to ask about the course of the complaint. Is it progressive, regressive, or the same? You need to analyze the complaint very quickly because time is limited. And it is always advised your history should be targeted. Although you have got 15 minutes in the long clinical consultation, however, spending a lot of time in the history is going to have a negative impact upon your performance, because history is going to evaluate only one skill. However, during clinical examination, you are going to be evaluated by 3 skills. And don't forget, while you are doing your clinical examination, you are allowed to obtain clinical information as well. So my advice, don't waste too much time in the history. Your history should be targeted and your examination should be targeted as well. So after you analyze the whole complaint of the tiredness, then you need to come and ask about the key question in the tiredness, which is it related to any time of the day? I mean, is it in the morning time? Is it in the evening time? Or is it all over the day? If we take it now, if the patient told you mainly it is in the morning, so the main differential diagnosis here is going to be obstructive sleep apnea. Then you need to ask about snoring. You need to ask about headache. You need to ask about daytime somnolence. And then you need to ask also about tiredness, which is already mentioned by the patient. It is going to be mainly in the beginning of the day. Plus, very important question, screening questions to know the cause behind obstructive sleep apnea. For example, hypothyroidism. This is concerning if the fatigue is in the morning. If the patient told you, no doctor, it's mainly toward the end of the day, or it's mainly after I have or doing heavy exercise. So if it is after doing heavy exercise or by reaching toward the end of the day, so the main differential diagnoses here are going to be myasthenia gravis or Lambert-Eaton myasthenic syndrome. And don't forget, in both of these diseases, you need to approach them by this. Number 1, autoimmune screening. In the history, and any examination as well. In addition to that, you need to ask about skin rash to rule out pemphigus vulgaris. In addition to that, you need to ask about weight loss, night sweats, fever, lumps or bumps, or any history of coughing of blood. And why to ask about all of these symptoms? Because, as you know, Lambert-Eaton myasthenic syndrome is usually associated with underlying malignancy, in particular the small cell lung cancer. That's why it's very important to rule out all of these if you are suspecting Lambert-Eaton myasthenic syndrome. In addition to that, you need to ask about diplopia and ptosis toward the end of the day for ocular myasthenia gravis. In addition to that, if you are suspecting a patient with myasthenia gravis, never ever forget the 3 Ds. The first one is dysphonia, any change in the voice. The second one is dysphagia, difficulty of swallowing. And the third one is dyspnea, to rule out exacerbation of myasthenia or myasthenic crisis. These are the most important questions if you are encountered with a patient with myasthenia gravis or Lambert-Eaton myasthenic syndrome. As I have told you, now we have discussed if this fatigue is in the morning, so screening for obstructive sleep apnea. If it is in the evening, I will highlight it for you here. You need to suspect myasthenia gravis or Lambert-Eaton myasthenic syndrome. If the patient has told you that, doctor, it's all over the day, now the differential diagnosis here is going to be like this. And don't forget this mnemonic: any educated man can do perfect function. Don't forget this mnemonic, guys. Any educated man can do perfect function. So A stands for anemia, and the screening questions of anemia: have you got any shortness of breath, any heart racing? Has anybody told you that you are becoming more pale than usual? Is there any bleeding from any other orifices or any other body openings? And do you take any blood thinning medications? The letter E stands for endocrinopathies, and I will come at the end to explain how to approach for the endocrinopathy. Then the letter M stands for multiple sclerosis, and in multiple sclerosis you need to ask about any limb weakness, any eye pain, especially after taking hot shower, any numbness, and any problem in the balance. Don't forget about these guys. And then the letter C stands for cancers and chronic fatigue syndrome. And in cancer, you need to ask about fever, any lumps or bumps, any night sweats, any weight loss. And in chronic fatigue syndrome, it is actually sharing some similar symptoms between it and between fibromyalgia. These sharing symptoms could be either joint pain, any mood disturbances, and any sleep disturbances. However, chronic fatigue syndrome has got its own characteristic features, which is tender lymphadenopathy. So you can ask the patient about, have you got any painful lumps or bumps? And don't forget that it is exacerbated usually by sore throat. So you need to ask the patient about any recent history of sore throat or not. They are very important. Then the letter D stands for drugs, and in particular statins, tricyclic antidepressants, and antihistamines. The letter P stands for psychiatric illnesses. And then finally, the letter F stands for fibromyalgia. And as I have told you, it shares similar symptoms with chronic fatigue syndrome. However, in fibromyalgia, you need also to ask about sleep disturbances, okay? Any concentration problem, any joint pain, any headache because of migraine, and any tummy pain because of irritable bowel syndrome. And usually fibromyalgia symptoms exaggerated or triggered by trauma. So it is very important to ask about any recent history of trauma or not. Now, coming back to the endocrinopathies, the key question here is to ask about the weight. Is there any weight loss or any weight gain? Regarding the weight loss, I have already discussed it in one of my videos. You can go and look on how to approach regarding the weight loss. Regarding the weight gain, the key question here, is it localized or generalized? If it is generalized, there are several differential diagnoses like hypothyroid, polycystic ovary syndrome, and panhypopituitarism. If it is localized, the most common two examples encountered in the PACES exam, either Cushing and acromegaly. This is the way how to approach the patient with fatigability. To sum up, if it is in the morning, it is mainly obstructive sleep apnea. If it is at the end of the day, it is mainly myasthenia gravis or lumbar eating myasthenic syndrome. If it is all over the day, it is either one of these mnemonics: any anemia, educated endocrinopathies, MAN myasthenia gravis, CAN cancer and chronic fatigue syndrome, DO drugs, perfect psychiatric illnesses, and F